Well, hello everyone. I think we are live. I think. Good. Can you hear me? Am I on? Yep. Hello from Tokyo. Hello there. Right. Lots of questions coming through already. I think what I'll do is I'll do a couple of questions and then we'll talk about a few different things. Now, I've just seen a question here. I have to wonder how this goes slow. Right. Now you can never do these at the right time for everyone. So this one was kind of supposed to be Australia friendly. So my apologies to friends in the United States. It's not a United States friendly time, but there we go. Now the first question I've got is, can dogs catch it? Now, there was a case in Hong Kong where a dog tested weak positive, and I haven't heard anything more about that. So what I suspect has happened there is that the owner had the virus, and the owner was shedding the virus in his breath and his coughing, and it just settled on the dog's mouth, in the dog's mucous membranes. So I don't think there's any evidence that the dog got it. It would probably be just as positive as an apple that was sitting on his bench or something that was on his bench. So as far as we know at the moment, there's no evidence that dogs can get it. So carry on being kind to your dogs, and of course dogs are a great source of reassurance in times that are difficult. So I think the answer to that question at the moment is no. I don't think dogs can get it. It did come from bats. It's a zoonotic virus, and the thing about viruses is they're normally very species specific. So there's lots of diseases your dog can get, like kennel cough and distemper. I don't know, I'm not a vet, that you can't get. Then when you get diseases, very often your dog won't get it, or virtually never your dog will get it. There are a few infections can spread from dogs to people in feces and things like that, but it's not that common. So at the moment, the evidence is that dogs and other animals that we have domestically can't get it. Now, this is remarkably boring, but I've had lots of questions about me. So we've got a pandemic on our hands, and people are asking about people like me, which is very nice. But I'll tell you about me anyway. So I trained as a psychiatric nurse and then as a general nurse, and did various jobs doing that. Did some work in the tropics, did some work on theatres and in neurology, and then I spent a little time on intensive care and cardiac care, and then I went away and did a nurse tutors course, as we called it in those days, and I became an official person who trained nurses, and I did that for 27 years. So I've trained up a couple of generations. I've actually had a few cases where I've trained mother and daughter. So the mother, I've trained the mother, and then towards the end of my career, the daughter came in for training 18, 19 years later. So yeah, I did that. But then in the course of that, I went a bit academic, so did various degrees, Bachelor of Science degree, Master of Science degree, Health Science. And I'd started doing research, so I did a PhD and did researchy type things. And so if you can make an original contribution to your field, they give you a PhD for that if you write it up. So that's what I did, and I looked at actually pretty well what I'm doing now, looking at how open learning materials and resources can be used in different settings. And I analysed my books. So during my academic phase, I wrote a couple of books. So I started off with this one. You can get these as PDFs. I'm not advertising, just background about me. That one's on physiology. So, all nurses and doctors need to know about basic physiology. And that's in white. And then black, disease is bad news, so that one's in black. That's the pathophysiology one. So that's in black. That's about disease processes. So I did that, did the research. Then a few years ago, I retired from full-time teaching and started doing some part-time work on a local A&E department. So I was an A&E staff nurse for part-time for a few years. And we're now sort of semi-retired, so that's me. So that's the boring bit out of the way. So basically, I'm a bit of a burnt-out academic. So you can make what you what you like of that, nurse academic and nurse teacher. But I've always kept up to date with clinical work. I've had teaching trips to Cambodia and India and places like that, and Africa, Kenya, and tried to keep up to date with clinical things as well. And looking at disease really has been what I've done all my life, looking at diseases. And I don't know, I'm looking at the microphone, I should be looking at the camera. Looking at diseases and physiology and how the body works and how it goes wrong. So that's kind of my thing, really. Right, let's take another question, having dealt with that boring bit. Good morning. People say good morning, which is very polite. When you go into class, sometimes when you're just thinking about the content, you just say, right, get your pens out, we're going to start drawing a heart or something. And you should always say good morning first. It's always essential to be polite first. Right, I think we'll just do a little bit of news by way of background. It's hard not to be a little bit pessimistic at the moment. Let's look at some news anyway. Just try and keep to the facts. We don't want conspiracy theories. We want to look at what the science is telling us and what the accurate reporting is telling us. So it's Sunday, the 1st of March. The year of grace 2020, and we're looking at COVID-19, and this is caused by the virus called SARS, coronavirus 2. That's the name of the virus the World Health Organization has given it. Now it's a bit of a confusing name because SARS was the 2002-2003 epidemic. But it's severe acute respiratory syndrome, CO, coronavirus, and it's not the one that caused the 2002 outbreak, it's this new one, so it's type 2. And the disease it causes is corona, virus, disease, first identified in 2019. So remember that, it's a novel virus, this is a new disease. It's novel. We haven't seen it before. Beginning of last December, I don't think I'd ever heard of it. Certainly in November, I'd never heard of it. So we've been trying to learn about it as we go along. There's things starting to come out on it now. It's hard to keep up to date. Things are changing very quickly. So let's give a quick recap of the news. 59 countries now have cases. Now, a pandemic is when there is community spread from person to person going on in a wide variety of countries, and in my view now we are in the early stages of a pandemic, unfortunately. Now, just by way of background here, the COVID-19 virus is just that, it's a virus. And yes, it's a virus, so you can get infections with different types of organisms. So you get infected with bacteria. And since just after the Second World War, we've had very effective antibiotics to kill bacterial infection, although we are struggling now with bacterial resistance to antibiotics. But viruses we're still not very good at treating. Now, there are some antiviral drugs for HIV, for example, that will keep HIV at bay. There's some for herpes simplex viruses. There's even one that's been developed for Ebola, which is being tested at the moment as we speak in China to see if it's suitable for treating COVID-19. So that's looking promising. But the point is, with viruses, we can't treat them with antibiotics. And viruses are difficult to treat. They are tiny things. They're about 100 this particular virus, the COVID-19, is about 100 microns in diameter. It's absolutely tiny. That's about 10 times smaller than a bacteria. And a bacteria is about 7 or 8 times smaller than a normal human cell, like the cells that are in you. And these viruses actually get inside the body cells. That's how they work. So the virus, when you inhale it, doesn't do any harm. The problem is it gets inside your cells. It parasitizes the cells. Because a virus is an obligate intracellular parasite. It can only live inside cells. And this COVID-19, the SARS, I'm going to call it the COVID-19 virus. I get confused when I talk about SARS-CoV-2. So the SARS-19 virus, it gets into the respiratory tract, and that's why it causes these respiratory features. and to some extent gets into the gastrointestinal tract as well. So that's why there's a problem, really. Viruses are transmissible but difficult to treat. And our main line of defence against viruses is vaccination, it's prevention. And all the clever scientists all around the world now are working frantically for us on the COVID-19 vaccine. But it's difficult to do. There's a lot of stages to go through. It's a complicated process. And there needs to be animal trials and human trials and trials of efficacy to see if it works. Safety, it's got to be safe. We can't go injecting people with something that's not safe. And that takes a lot of time. So realistically, we're probably not going to have a vaccine for this disease until 2021. So our main line of protection, like we use for mumps, measles, rubella, all those other things that we've known about for years, we haven't got the vaccine yet. This is why there's a problem. This is why it's spreading. So the fact that it doesn't respond to antibiotics, the fact that viral infections are difficult to treat, the fact that it's transmissible, and the fact that we haven't got a vaccine because it's new, are why we're having this problem. This is why we're in the early stages of this pandemic. This is what's happening. So South Korea, a lot of cases, I'm afraid. 36 countries have stopped travellers from South Korea. Churches are having online services. Very good idea, because public gatherings are not good in this environment. And it's a critical moment. The South Korean government are asking people to stay at home. So, yeah, that's the situation in South Korea. We'll look at some more news in a minute, but let me just try and answer some live questions. I need to work out how to put this in slow mode. Okay, question there about the death rate. Yeah. Now, I will learn how to put it in slow mode for next time. Now, the death rate. Gone into emojis now. Yeah, the death rate. Now, the death rate in COVID-19 is substantially higher than it is in. Am I back?
John, you're back on.
Right, my wife's told me I'm back on. Okay, thank you. Right, now I don't know what happened there. This happened last time I was live streaming. It could just be a fault in my computer, so apologies about that. Let's hope it doesn't do that again. Thank you for all the tips I'm getting here. Right, I'm back on. Right, so, yeah, I was asking a question about the death rate. Now, the death rate is higher than influenza. And it's looking at the moment like the death rate is probably going to be about 0.5 to 1%. But it's very hard to give figures on that in the early stages of an epidemic. Now, when we look back on this in a few years' time, we'll be able to see how many people got the infection and how many people died, but it's hard to tell at the meantime. But what we do know, so the current sort of guesstimate is around about the 1% mark. That's what we're thinking at the moment. But the people that are more likely to get severe disease are older. Children at the moment, it seems, are less likely to get severe disease, which is good news. And the people with comorbidities, so that means they've got other diseases at the same time, are more likely to get serious complications and to die from this. So people with chronic chest diseases, heart diseases, and poorly managed diabetes, hypertension, things like that. So I guess it's important to try and optimize the state of your health as much as you can. So that seems to be the factors that are affecting the death rate. The other thing that's affecting the death rate is the availability of medical care, and the quality of medical care. So one of my concerns is when this gets into countries with less developed healthcare systems, that people are not going to get the healthcare they require. And in fact, even in advanced Western countries, if there's a lot of people sick all at the same time, it's going to be remarkably difficult to provide them all with quality healthcare. So if we say about 1% now for the death rate, we won't be too far out. Now, I think we'll just do a couple more news items just to guide us to what's going on today. Italy. Now, Italy, again, remarkably concerning. A lot of cases and a lot of deaths, and quite a few cases have spread from Italy as well, as we'll see. Iran, we've looked at complications in Iran. Religious shrines are still open in Iran, apparently. There's been a lot of coming and going for the 40th anniversary of the founding of the Islamic Republic. And but these are certainly underreported. A lot of members of or several members of the Iranian government are affected. Japan, there's been quite a few new cases as well. Singapore, some more cases. France, ban on public gatherings over 5,000. Guess that means football matches are off. Hong Kong, which was badly affected by the original SARS in 2002. UK's got 23 cases. And US, Australia, Thailand have reported their first deaths. Now, these are informative, really. The death in Thailand was a 35-year-old man, which seems alarmingly young. But he also had dengue fever. Now, dengue is a common mosquito-borne virus in Thailand, in various places in Asia. So what it's looking like is if people get the COVID-19 and another virus at the same time, that's a bad combination. So this is another reason to try and avoid crowded areas and to be meticulous with hygiene, because there's a lot of influenza around us now. So we don't have data on what happens if you get COVID-19 and influenza together, but clearly it wouldn't be an ideal situation. In Australia, there's 25 cases, and the first death in Western Australia. It was someone who was repatriated from the Diamond Princess cruise ship, which was in this somewhat ill-fated quarantine in Yokohama in Japan. Right, let's try and take some questions. How close in similarities, this is Blue Rose, the COVID-19 to the Spanish flu? Yeah. So the Spanish flu, called different names, it probably originated in the United States in 1918, and it was influenza. I think it was an influenza type A. It came from animals, and it infected a chicken farmer in the United States. And then he seemed to join the army and went to an army base, and it spread from there, and it spread in the troop ships in 1918, in the later parts of the First World War. And then it spread into Europe and spread around the world from there. So 1819, there was a pandemic of influenza. Probably 60% of the world's population were infected at one time or another. And it caused... no one knows how many deaths, 50 to 100 million deaths. Now, can we compare these two? Well, medical care is much better now. Producing vaccines is much better, although we're not there yet. Antiviral drugs are much better now. But of course, the thing that's gone against us this time round is the interconnected nature of the world. People flying around the world and travelling round. I mean, people travelling within China was one of the original problems, because it was Chinese New Year. And now we've got diseases spreading around from China, from Singapore. From Singapore, one guy caught it from a Chinese man in Singapore, flew back to France and back to the UK with it. Flights, people carrying it out of Italy. So an epidemic, a pandemic can move around the world much quicker these days, unfortunately. It's far too early to compare the two epidemics, far too early. So the answer to the question is, I don't know. The answer to the question is, let's hope not. Right. For people who recovered from severe cases, are there any known long-term complications, such as reduced lung capacity? So after diseases, you can get sequelae. So after a viral illness, it's normal to feel quite tired for a period of time, sometimes quite depressed. I had influenza once and just, was actually quite depressed for a couple of months afterwards. You just don't want to do things. And so you can get those effects. Now, maybe there are some cases, there are some indications that there may be damage to the lungs in a minority of patients, but I would hope it's the minority of patients. And there's also some possibility of cardiac damage in a minority of patients. But again, like so many things with this virus, is there's not a lot of data on it yet. There are some isolated reports that it may happen, although it's looking like most people do make a full recovery. Always remember that about 81% of people get a very mild illness, and we would expect to make a full recovery. So sequelae, limited data on that at the moment is the answer. Question there about commercial livestock and safety. Well outside my area of expertise. I would expect, as we've said with dogs, we're not expecting this disease. The literature doesn't seem to be expecting this disease to be transmitted by animals, despite the fact it is an original zoonotic infection. But I would imagine veterinary officers in various countries will be making statements on that fairly soon. So we have to go by the guidelines of our own national veterinary officers who specialise in exactly this sort of thing. At the moment, there's some things I'm worried about, but personally, I'm not worried about animals transmitting it or catching it from animals. So it's not a concern I have, no, at the moment. Someone says, prepare, don't panic. Absolutely. So we need to optimise the condition of our immune system. Now, to be fair, at the moment, I think we do need to moderate our socialising and our travel as much as we can. Now, I know people need to travel for work. This is difficult. And I don't want the airlines telling me off, but travel at the moment should be just for essential purposes only, really, in my view. And the problem is, because we're getting cases popping up in, how many countries did I say? 59 countries at the moment. What we're actually seeing, and we'll look at a specific example of this lately, is people that are asymptomatic carrying it. Now, what we mean by that is that people can be infected by the virus. They can be shedding the virus to those around about them, but still feel fine. They have no symptoms of the disease themselves. Now, whether they've got a very mild version of the disease and they are asymptomatic and they're not going to get ill with the disease is one possibility. Another possibility is they are pre-symptomatic. So people are infectious during the incubation period. This is a big part of the reason why this is spreading. If people only spread this when they were really sick, then we would know to isolate and avoid really sick people without taking the full precautions as we care for them. But the problem is they're not. So this could be spread by someone down the street potentially, once community transmission is established, who seems perfectly healthy. So my view at the moment is we need to stop sharing common utensils. So one example of spread has been religious institutions in Iran and South Korea. So I feel churches at the moment for communion should not be using a shared cup. You should have individual cups and cut the bread up into small pieces before it's distributed to the worshippers. That's just one example. Recently in the UK, I don't know what it is where you've lived, but we've become a bit continental lately in the UK, and we do sort of more hugs and this kiss on cheek thing, and we never used to do that in this country. We used to just shake hands. But at the moment, I think we need to moderate hugs, kisses, and handshakes. The Pope apparently has been tested for this because he was shaking hands, I believe, with people from Iran. So handshaking could be moderated for a period of time, I believe. Now, it's hard when you meet someone, you go to church or something, you just put your hand, it's just automatic in English culture. So maybe we just need to do this, like they do in Asia for a while. And I don't know, it's we need to moderate large gatherings, especially indoor gatherings, where a lot of people are together, especially if there's poor ventilation. So I think these are all sort of expedient things to start thinking about now. Someone asked about the UAE. I think there are 1 or 2 cases in the United Arab Emirates. Go onto the Johns Hopkins site. I will put the link to the Johns Hopkins site up, and the Johns Hopkins site keeps everything updated on all the countries around the world, where we are getting accurate data now from most countries around the world, which is good to know. How to protect smokers. Now, I don't think there's too much data on this, but in China there's a lot of pollution and smoking, and that certainly won't help. And there was some early data that showed that smokers were more prone to getting complications, which does make sense. So if you smoke, really this would be a good time to stop. I know it's difficult, but it is an addiction. But if you could stop smoking, I think that can only do good. Now, smoking does increase the amount of vitamin C that's broken down and excreted from the body. So if people smoke, I think it's important that they make sure they get plenty of vitamin C, oranges and tomatoes and things like that. In fact, if people smoke, they might even consider a vitamin C supplement. Now, I'm not a big fan of supplements generally, but I've been asked loads of questions about is vitamin C protective? Now, vitamin C might provide some mitigation of some viruses. With this one, basically, we don't know. But it's not a big effect. So I think the main thing is not to be short of vitamin C. So if you smoke, certainly talk to your nurses and doctors about it. But, if you take 50 milligrams or 100 milligrams of extra vitamin C a day, that's going to be fine. But better just to improve the quality of your diet. Oranges and tomatoes and things like that with vitamin C in, and cut down on smoking. The trouble is, if smokers take things like vitamin C, they think, oh, well, I smoke but I take vitamin C, so it's all right. It's not. Smoking does many things that are damaging. So good time to stop smoking if you possibly can. Lots of bugs around at the moment. I've had a cough just for the past month or so. I often do in winter. There's just lots of viruses around, and I'm not short of vitamin C. But what people are sometimes short of in northern climates, especially, I live in the north of England, is vitamin D. And vitamin D is involved in immunity. So the National Institute for Clinical Excellence in my country advise you can take 25 micrograms of vitamin D a day as a supplement in the winter months, which I do when I remember. Other than that, I don't really like supplements, but a healthy diet, of course, is very important for immunity. People that are malnourished will be immunocompromised. And sleep is also important. There's some new studies showing that sleep is important to help our immune function as well. And let's just go and look at a few more news items. Yeah, so this Thailand guide, probably comorbidities. The Australian one probably it's likely he might have caught it on this ship. How the virus was transmitted around the ship, we're not really sure. Was it in the air? Was it on contaminated surfaces? Probably a bit of both. Droplet infection. Now, Mexico, 4 cases in Mexico. Now, this is concerning. a lot of people in Mexico don't have good access to healthcare, so that's concerning. And apparently it was a 20-year-old woman who flew from Italy, who herself was asymptomatic. She had no symptoms, but was spreading the virus to those round about her, which is part of the problem, this pre-symptomatic spread. The US, 71 cases. Now, this is concerning as well. A 50-year-old man died with no epidemiological links. So the US health authorities couldn't work out where he caught it from. As far as I know, he hadn't travelled to China, he hadn't been mixing with people from China, he just seemed to catch it. And so no epidemiological links there. And the other thing was a bit depressing this morning, that the new cases in China are up slightly. Now, the Chinese had cut down on the new cases quite dramatically, but few new cases, more new cases now in China, despite large-scale bans on travel and restrictions on public meetings and everything. On Saturday there was 47 deaths. So that's kind of a review of the situation in the world at the moment. Now, let's go back to questions. Are people with HIV at more risk? That's a good question. I don't have any data to answer that. Common sense would indicate that anyone who is immunocompromised does have greater risk because the immune system is not working as well as we would like. But if people with HIV are maintained on good medications, then I would imagine that's getting their immune system back up to pretty well normal. So if they're well controlled on medication, I would expect the additional risk to be fairly minimal, but I don't have data on that. Chinese food. Okay, let's talk about food. Cooking will destroy the virus. Chinese food is no different from any other food, just that the epidemic started in China. That's all. It's not from the food. It's because the virus probably got from bats into some other animal into humans. That's how it started. Now, so cooked food I'm not worried about. Yeah, I'm there. Cooked food I'm not too worried about, but one thing that would be concerning is if food was prepared and then someone was to cough or sneeze onto that food or to touch that food with contaminated hands. And this could be a particular issue with uncooked food. So food could be, I don't know whether you call it a vector or a fomite. A fomite, I would think. It's an inanimate object which could spread the virus, just like a dirty pen could or something like that. Because we know it can spread on hands. So it could spread if someone had coughed on their hands, touched some food, fed that food to you, then that food would be contaminated. But it's absolutely not the type of food, no. So Chinese food is delicious and absolutely fine, and I would have no hesitation eating it. Yeah, people pointing out we should be washing fruit before we eat it anyway, which I agree with. I agree with that completely. Is the strain in Iran more virulent? That is a good question. Now, the death rate in Iran, does seem to be higher than other places. But that may be because poor medical care and difficulty getting to medical care. Not necessarily that there's a more virulent strain. And I was worried about this a few days ago, but I'm less worried about it now because I've been reading some more data on this. And what it seems to show is that the virus is fairly stable. Now, what we mean by this is, so if we think about this virus, it's a single-stranded RNA virus. So it's a single strand of RNA. That gets into a cell, a respiratory cell. These ones with cilia from the top. So the viral particles, that's about the scale of them next to the cell. They get into the cell They take over the cells, that's the nucleus of the cell, they take over the cell's genetic apparatus, produce many more viruses, they go onto the surface and they're breathed out. So that means there's many more copies of the virus. And inside the virus there's the same RNA as in the infecting virus. And then that goes on to infect someone else. But this means you've got millions of copies of the virus all over the world. So the virus could mutate. And mutate means there's a change in this genetic material which could make it more virulent. So what sometimes happens is there's a big genetic shift in an influenza virus. It mutates into a form of virus that the immune system doesn't recognise, and that can cause a pandemic. But the data so far on the coronaviruses is showing that genetically they seem to be relatively stable. So the virus in Iran is probably the same as the virus in Italy, basically the same. So is it a more virulent strain of the virus? Given that data is seeming to show that the coronavirus has got a relatively slow mutation rate, the answer to that question is I suspect not. I suspect it is not a more virulent form of the virus, but I suspect it's more difficulty with healthcare and accessing healthcare in Iran, which is more likely probably to be the problem. I do hope it's not a more virulent form of the virus. Doesn't look like it at the moment, so that's somewhat good news. Now the other thing about the virus, if a virus is mutating all the time, like HIV changes quite a lot, that's another RNA virus, then that makes a vaccine difficult, because of course we still have no vaccine for HIV after all these years of HIV problems. So if the virus is relatively stable, that's going to make it easier for one vaccine to be globally effective. And this really is there's two big hopes for this epidemic. One is behavioural change, and we reduce the spread, and the other is the spread can be stopped with vaccination, because once people are vaccinated and immune, they're not going to get the disease and they're not going to spread it, and we can stop the epidemic in its tracks pretty well then. But we haven't got that vaccine yet. This is the problem. So yeah, Darren, what's the risk for pregnant women? Well, there's only limited data on this. Data from women in the third trimester, the later parts of pregnancy in China, seemed to be that they were okay. There was problems in the first trimester of pregnancy with the coronavirus in 2002, 2019. So that is a concern. In the SARS-1 in 2002, 2003, there was problems with pregnancy. With this one, we don't know yet. So far, it's looking like not. But it does, until we get hard data on that is a worry, because it's one of the things we're not really sure about at the moment. There's many things we don't know. Yeah, someone's saying there are differences in the virus. That there have been mutations in the virus. It may be, but it's kind of not known as a fast mutating virus. Yeah. Yeah, why do people die from this virus even though they have good medical care? That's a good question. It's probably related to so what happens is, if there's severe inflammation in the lungs, the small airways, they're the bronchioles that divide into small respiratory bronchioles that go into the alveolar air sacs. These are the near microscopic air sacs in the lungs where the oxygen goes into the blood. and the carbon dioxide goes from the blood back into the lungs. There's something called ARDS, Acute Respiratory Distress Syndrome. So what can happen is that due to the inflammation, the fluid collects in here. And if lots of fluid is collecting in there, you can't get the oxygen in and you can't get the carbon dioxide out. This is the problem. And also, as well as the ARDS, this can cause pneumonia. And pneumonia is infection at the level of the alveoli down here in the lungs. Now, if the pneumonia is caused by the virus, at the moment we don't have antiviral treatments. But sometimes the pneumonia can be caused by secondary bacterial infection. And if it's caused by secondary bacterial infection, of course we can treat bacterial infections with antibiotics. So very often these patients will be given antibiotics for the bacterial component. But if it's viral, we can't treat it. So that can be difficult to treat. So that's going to reduce the amount of oxygen in the blood, which of course we need for all life-giving processes. Now, having said that, there's many clinical trials going on in China now about therapeutics. So we should know in a week or two's time what drugs have what level of efficacy against this virus. And of course, this is information we're absolutely desperate for, and we should be starting to get that fairly soon. So there's some antiviral drugs which are showing promise, and there's other drugs like chloroquine which might have some efficacy against this virus. They might work to some degree, either as prevention or as a treatment. And we should have that data really soon. We need to delay things as much as we possibly can so we can get more science done. So can we cure the virus yet? No, we can't cure the virus yet. Alas, not yet. Okay. Right, when you said not to use steroids, right, okay. Now, this is not a prescribing channel. You have to ask your own doctor what drugs you should take. What we did say is that I was told by people in Iran that they take a lot of corticosteroids at an early stage. And that probably wouldn't help in the prognosis, because the steroids will reduce the inflammation and reduce the efficiency of the immune system. But if you're taking any medications, for goodness sake, don't stop for anything I say. Always call your own doctor. People with asthma sometimes do take steroids, and be guided by whatever your doctor says on that. There are no rules. You are an individual. You have to be treated as an individual by your own doctor or your own prescriber. So if you're worried about it, ring up your doctor and ask them. Does strong alcohol kill it? Yes, with strong hand rubs, alcohol will kill the virus. But I think it's better. In fact, I'll do this now. Let's go on to... yeah, we're on the corner one already. So if you look up your own national guidelines for this, everyone has national guidelines on it. So this is the one I've looked up from the NHS for hand washing. So get this from your own country. They are available. There's videos and all sorts on it. And check on the proper way to wash your hands, because when you wash your hands, it's so easy to miss bits. Now, this is the way we would wash hands work before carrying out a clinical procedure. And it seems a good way to wash your hands. So first of all, you wet your hands. Then you put on plenty of soap on your hands, plenty of soap. Then you rub your hands palm to palm, so like that, to get the soap lathered up a bit like that, palm to palm. Rub the back of each hand with the palm of each hand. So that means this. So palm to palm, then you would do that. And then wash the back of the other hand like that. That sort of washing there like that. Then palm to palm, fingers together like that. So that is that motion there. Rubbing your hands together like that. That way. So you're covering all the bits of your fingers. And then back of the fingers from side to side. So that motion is this. So hands together like that, rub like that. That's the next one. And then thumbs. So the way I wash my thumbs is like this. That one and that one. Getting in that little crack, not crack, that divide there. So thumbs there like that. And then the next one it's telling us to do is fingertips and palm. So to clean your fingertips. So that is cleaning your palm and your fingertips. And then of course with that hand as well, palm to fingertips is the next movement. And then rub each wrist with the opposite hand. So it's washing the hands and then washing the wrists. So basically you're washing up to your, you know, up to about there. So wash each wrist like that. And that one. Like that. Then rinse your hands. Now the good thing about using soap is the soap breaks down the sebum, this oil in the surface of the skin. And the viruses are attached to that sebum. And they'll be washed away in the flow of water, which is good. And then knock the tap off with your elbow. Now in some public toilets, they have the old-fashioned type of taps that you have to turn with a handle. So what I'm recommending, I think it's a good idea, start carrying your own tissue around. I think that's a good idea. So you can take off the tissue, you can dry your hands like that. Then if the tap is one of the old-fashioned sort where you can't knock it off with the elbow, you can turn it off with the tissue so you don't dirty your hands again. And then as well as that, when if you're in a public toilet, public toilets are especially dirty places. This virus and other viruses are spread in feces, and we think this virus is also spread in urine. So when people flush the toilet, there can be flushing of the virus into the air. It can get onto the walls. It can be suspended in the air for a period of time so you could breathe it in. That's called fecal oral transmission. Or you could touch the walls or the toilet seat with your dirty hands. So we'll always put the lid down before you flush the toilet. But then when you finish washing your hands, if you've got your own tissues especially, you can't do it with these hand drying machines, but if you've got tissue you can. Now suppose my torch here is the toilet door. So what you would do is you'd have the tissue in your hand like that you've dried your hand with, and you can open the toilet door touching it like that. And then when you've opened the toilet door, you can hold that in your hand like that. That's the dirty side inside. Crumple that up and discard that. So regular hand washing, because of this risk of the virus going from surfaces into your mouth, absolutely vital. So because not everywhere has it, just start carrying some tissues. Why not? You know, carry some tissues. The other thing about tissues is, suppose you needed to press a button in a lift. Let's imagine my torch is so you can have the tissue, and you needed to press a cash line perhaps, or buttons in a lift. And of course you can put the tissue over and press it like that. And in Chinese lifts they've got boxes of tissues where you can press the buttons through a couple of layers of tissue. And of course when you get home, always wash your hands when you get home. Now if you look on these national websites, there's another one here for hand gels rubbing, so much the same really. Cleaning with hand gels, much the same procedure. And my guidelines here are saying that we should be washing hands for 15 to 30 seconds. So I think it would say 20 to 30 seconds. So it's not a quick done. You know, you've got to wash your hands as a purposeful activity. Keep your hands clean and then consider not recontaminating them afterwards. Gloves, of course, are also a good idea. if you use gloves, that's going to keep your hands protected. So if you have access to gloves, also a good idea to use gloves. Okay. Take some more questions. Yes, some more questions about asthmatics stopping their steroid inhalers. For goodness sake, talk to your own doctor. Do not take advice from the internet, especially from me, on taking your own medications for your own medical conditions. Talk to your providers. Now, if you're worried about this, then try and get through to your doctor or your nurse practitioner or whatever it is at this stage. Be prepared. This is part of being prepared. Getting the the medications in that you're likely to need yourself, and the medications that you need to maintain your own medical condition if you have one. And talk to your doctor about the best thing to do. Right, summer temperatures will reduce coronavirus spread. The answer is to that, at the moment, we actually don't know. Now, influenza is very seasonal, as you know. You get much more cases of influenza in winter than you do in summer. It's a very seasonal condition. But with the coronavirus, we don't know if it has seasonality or not. I don't know of any evidence so far that it does have seasonality. But there again, I have no evidence that it doesn't have seasonality. What we do know from the SARS-1 is that the virus lasted for longest on surfaces at cooler temperatures. So as the temperatures went up to 20 degrees, the virus didn't last for as long. It didn't survive for as long on surfaces. And at 40 degrees, it survived even less time. But we are seeing transmission in Singapore and southern China and Hong Kong, places that are relatively warm. So I'm hoping that it's spread less in the summertime in the northern hemisphere and in Australia. And of course, Australia's in summer now, isn't it? New Zealand's in summer now. But the answer to that question is we just like so many things, we don't know. So we hope so, but we don't actually know the seasonality. Now, John Martin, what type of soap? That's a good question, John. I've never thought about that before. Liquid soap is good because you can kind of, you can get it all around your hands quickly and easily. So it's maybe quicker to use liquid soap. But the principle with soap is I don't think it matters too much what type it is, as long as you get a bit of a lather, because the soap has got a solvent that, as we said, mobilizes the sebum on the surface of the skin. This sebum on the surface of the skin, and that allows you to wash the virus away once it's mobilized. See, look what I'm doing now. I'm touching my face with my thumb. It's just it's just such a terrible habit, isn't it? If you've got contaminated hands, it's not a good thing to do. So try and avoid that. Get your mum to tell you off every time you touch your face with your hands or something. What do I recommend for people flying, travelling? Well, heck, I think one American airline and British Airlines aren't flying to Milan at the moment, so the airlines are already starting to take precautions from this. The airlines are already starting to do that. The World Health Organization, I'm not sure what their latest thing is, but initially the World Health Organization were telling us that we can still fly to China in January. So that was, looking back, that was the World Health Organization. It's easy to criticize them, but they've got this balance. They've got this balance to make between public anxiety, economic effects. They didn't have crystal balls. looking back, were they a little cautious in what they were doing? Yeah, they were. They should have maybe been more proactive. But it's easy to criticise afterwards. But I do wish they'd been more proactive at the early stages. And the Chinese response was very two-faced. To begin with, it was terrible, but then later on, it was very good, and still is very good. But yet there's still an increase in cases in China yesterday. So that was. Let's hope that is just a blip. Will this go away like SARS? That is a good question. SARS was easier to isolate because it was sick people that were spreading the virus. I fear this is going to go on spreading because it's spread by healthy people. Now, will it go away? The answer to that question is we don't know. Will it go away completely at the end of this epidemic, as previous epidemic viruses have? Certainly hope so. But there is a possibility that it could become endemic. Endemic means it's pretty well always present in the population. So, for example, I think we could say that influenza is basically endemic. There's always people with influenza. There's always people with common colds. So I really hope this virus will not become endemic, and we'll be able to look back in a few years' time and say, remember when we used to have coronavirus? If we get a good vaccine, that is going to help massively. But at the moment, I'm afraid I don't know the answer to that question, and I'm not sure anyone does know the answer to that question. But we certainly hope so. Let's look at some more questions. Someone says we're all going to die. We're not all going to die. 80% of people get a mild case. You know, I think part of the problem here is that throughout human history there's always been infectious diseases. If you look in the Bible, there was something called the plague of Ashod. And, there's always been plagues, there's always been epidemics. There was the Black Death, the bubonic plague that swept through Europe. There was cholera, there was influenza, there's been SARS more recent. HIV, of course, has been a pandemic. But, people used to get infectious diseases before antibiotics, and that was a big problem. Well, we've kind of grown up in a generation where infectious diseases haven't really been a problem, and we've kind of, in a sense, we were spoiled a couple of generations. My generation and the generation which most of you are in, I suspect, have been a bit spoiled. We're not used to this idea of infectious diseases, but it's always been part of the human condition. And very often what happens is a certain proportion of the population have a natural immunity to it. But with this virus, as we know, 80% of people are going to get a mild illness. Around about 10 to 14% are going to get a more severe illness, and hopefully most of those will just lie down and recover, but some are going to need medical management, and this remains my concern. We really need to contain and delay this as long as we can, because what we don't want is getting thousands of cases all at the same time, and the potential for that is there. But how quickly people get affected is going to depend on our behaviour. How much we change our behaviour, how much we change the way we work, if we work from home more, if we travel less, if we practice meticulous hygiene, if we catch it, bin it, kill it. So if you cough or sneeze into a tissue, cough, sneeze into your tissue, wrap it so the inside is protected, bin it straight away. Coughs and sneezes bred diseases. Good toilet hygiene. Not spreading contamination to uncooked food. All these things can massively help. Obeying the instructions from the authorities if they're telling us to do things, to do them. Most people in China are doing this. The discipline has been very good for most people in China. These videos you see in China have been told from contacts in China of people being bungled away. Apparently these are people who have broken their quarantine when they're infected, and even after warnings are still broken the quarantine, and then they have to be taken to centres. So I don't think it's as bad as it's appearing, but really we have to be considerate. Now we are no longer individuals. We are this amazing, wonderful human race, and we have to work together. And a vital part of that is protecting others around you. And as you protect others around you, that will also help to protect yourself and your family. We really need to work together on preventing and protecting from this condition. So in New Zealand, what precautions should we be taking now? Well, getting into the right habits, I think, is probably the answer now, because this is coming. This virus, if I'm right about the pandemic, it is coming to basically every country in the world, or it's looking that way at the moment. Okay. What is close contact? That's a good question. The answer is probably 2 meters. A meter or two is probably close contact for a period of time. So that could include things like getting your hair cut, couldn't it? That would be close contact for a period of time. Beauty therapists with positive, yeah. I mean, that's close contact. You're within a meter of someone for 15, 20 minutes. I would define that as close contact, yes. Right, if you get it, are you immune to it later? Well, what happens normally? Let's just have a look at what happens normally. So, what happens normally with a viral infection is you get the virus, and that's recognised by your body as being foreign, and that's an antigen. So an antigen is anything that your immune system recognises as being foreign. That stimulates some white cells called lymphocytes. Others as well, but mostly lymphocytes. These lymphocytes produce antibodies. And antibodies are the immune proteins, the immunoglobulins. And it's these antibodies, these immune proteins, that fight the infection. So, for example, the immunoglobulins can clump lots of viral particles together all in one place. And then a nice big cell can come along and eat them, called a macrophage. Can eat them up. Cells can eat them. That's a process. That's called phago. Anyway, phagocytosis, cell eating. But the point is, you make these antibodies. So an antigen is an antibody generating molecule. So the antigen, that is the thing that's foreign. In this case, the virus stimulates the body to make antibodies. Now, these antibodies would confer immunity if you were reinfected by the same virus. Now, what we haven't got yet, and clever people around the world are working on this. So, for example, if I want to know if you've had HIV, HIV is the human immunodeficiency virus, then I wouldn't test for the presence of the virus. What I would do is test for HIV antibodies. Now, if you've got HIV antibodies, those antibodies were made in response to the HIV antigen. So if you are antibody positive, that would indicate you've been exposed to the virus, that you have the HIV virus. And of course, the HIV virus persists in the body. It persists. Now, as far as we know, the COVID-19 virus doesn't persist in the body. We're expecting it to be eliminated. Now, the reason I'm saying that is the people that were quarantined in my country, in the UK, They flew from Wuhan. They were quarantined for 14 days. They didn't get symptoms. There was 100 of them in this quarantine. And before they were released, they were all tested 3 times. And they were all negative. But there again, they probably never had the disease in the first place. But in China, the criteria for being cured is an improving chest x-ray, no fever for 10 days, and 2 negative tests. And then they're declaring someone cured. So that's quite a high bar, really. So it seems to be that the Chinese data is showing that when someone is better clinically, sometime after that. Now, the thing with this disease is we don't know how long that is. Now, normally you'd expect the number of viruses to go down quickly when the antibody number goes up. But with this disease, it may be that the virus does hang around for a little longer. So to be safe at the moment, after someone is clinically better, after they've had the virus, ideally they would be tested to demonstrate that they are negative. But until we know how long it takes to clear the virus from the body, it would be safer to leave people in isolation for a week, perhaps, after they are feeling better, until it's highly probable that they are no longer infectious. You see, I'm choosing my words carefully here because there's a lot of things we don't know. That's the problem. So what I would say is be cautious that people may still be infectious for a period. I'm doing it again, look. Terrible habit. Be aware that people may be infectious for a period of time after they are clinically better. That's an issue, but it doesn't seem to persist like HIV. But what I was saying is HIV produces these antibodies and we test for the antibodies. Now, the reason the antibodies don't clear the HIV virus is because it hides in your white blood cells, but that's a different story. So these antibodies, and as well as that, these lymphocytes make another type of cell called a memory cell. A memory lymphocyte. And this remembers that infection. So if you're exposed to the antigen again, the memory cells can start bashing out lots of antibodies in pretty short order. So like you can get a cold, suffer from the cold, then if you're re-exposed to the same cold virus, and then you probably won't get the cold again, because your antibodies will kill it before it's got a chance to cause disease. So the problem at the moment is for the COVID-19 we don't have the antibody test. Now when we do get the antibody test, and I'm hoping it won't be long, that's going to be useful, because at the moment we're only diagnosing with the virus, with the antigen. We're using the virus to diagnose it. That's what this PCR test is. Polymerase chain reaction test. We can't test for the antibody. So an antibody test would be an extra, very useful extra weapon in our armoury against this condition, because we could tell if people had been positive. So to get back to the original question, do people completely clear the virus? We think the antibodies completely clear the virus at the moment because people in China are getting negative cultures, and we hope that is the case. Now, having said that, there are some cases of reported reinfection. Now, what's happening here is unclear. Now, if the virus mutates a lot, then you could be reinfected, but we think that is not happening. So it could be that people's immunity is not very high for a week or two after they've had one infection, and then if they're reinfected again, they could get the disease again. That's possible because it might take time for the antibodies to build up. So what we're saying is this disease might be a little bit atypical, in that it takes time for the virus to be cleared, maybe a good few days after people stop being ill. And we're also saying it might take time for the antibodies to build up to give us protection. So that means that someone who is recovered from the virus perhaps at the moment, given the data we know at the moment, is best to carry on being self-isolated, because we don't know if they're spreading the virus to other people yet. We don't know how long that takes for them to stop shedding the virus after they start feeling clinically better. And as well as that, we don't know what their risk of reinfection is for a period of time while we assume their antibody numbers are building up. So there's a couple of things we don't know there. So to be cautious, just assume that people could be reinfected after they get better for a period of time. And if we assume that people can be infectious after they're feeling better for a period of time. Because if you're anything like me, as soon as you feel better, you tended to go back to work, and you can go back to work too early. It's not a good thing. Now, I've had quite a few questions about self-isolation, and of course this is remarkably difficult. So if you live in a nice big country house somewhere, you could just go up to the west wing and isolate yourself and it will be fine. But most of us just live in relatively small houses, so if you live on your own, it's not so bad. You just go in, shut the door, no visitors, get food delivered to the doorstep, and that's okay. You can isolate yourself. But if you live in a family, it's much more difficult. So a sick person should be nursed in a separate room, if at all possible, with the door shut, and ventilate that. Keep that room well ventilated is probably the best advice. Keep warm, take plenty of fluids. My advice, if you're ill, if you feel like eating, eat. If you don't feel like eating, don't eat when you've got viral infections. Your body kind of guides you, I think, what the best thing to do as regards food. For most of us, if we don't eat for a couple of days, it's not going to do me too much harm, that's for sure. That's acceptable for most of us. For children, it's not, of course. We need to keep children well fed. But it's looking like children get less severe form of the disease, which is very encouraging. That's not always the case. By no means is that always the case. So it's encouraging with children at the moment. A couple more questions, then we'll finish. Must be getting bored by now. Do children get infected? Right, okay. Right. This question is, do children get infected? Do they get sick? And do they act as carriers? Now, children often get infected with influenza virus. And even though they might not get the disease themselves, what children are very good at is carrying the disease home to their parents. So children often carry viruses. They can act as carriers. So is it that children get infected less with COVID-19, or is it that they get milder symptoms? Is currently not that clear. So does the young immune system actually protect them from getting the virus in the first place? Or does the young immune system mean that they're less likely to get severe form of the disease? Now, I suspect they still carry the virus for a period of time, but fortunately get a less serious form of the disease. But of course, if they're carrying the virus for a period of time, that means they will be infectious. So I would expect children to act as carriers in this disease. That would be my working hypothesis on this. So for now, I would assume that children can be carriers until proved otherwise, but I don't suspect it will be proved otherwise. I think we probably will find out that children are acting as carriers. How can we get across? Yeah. How can we educate our children about this? Very difficult, but we have to educate them as best as we can. Children learn by example, so teachers need to show children how to wash their hands. Parents need to show children how to wash their hands, how to avoid touching dirty surfaces and touching the face. We just have to teach them as best as we can. But children are renowned for being quite unhygienic, unfortunately. They need supervised, of course. That's part of being a child. They need supervised. Right. Adelaide, Australia has massive festivals over the next month. Maybe 500,000 attending. Well, yeah. I think it's in North Italy anyway has banned football matches. I think France has banned football matches. I think Switzerland has banned football matches. Now, obviously, if there's 50,000 people gathering together and there is no virus in the community, none of them are going to get it. If you've got no rabbits in a box and you come back a year later, there's going to be no rabbits. But if you've got 2 rabbits in a field and you come back a year later, it can be full of rabbits. So it depends how much virus is around. Now, at the moment, we are testing in the UK to find this out. So there's 11 hospitals and 100 GP surgeries at the moment that are testing people who come in with fevers and breathing difficulties and the symptoms that could be caused by COVID-19 to see if it's caused by normal influenza or whether it's caused by COVID-19, because we actually don't know. All I know so far is that one GP from the practices that were chosen as the pilot site for testing has tested positive. Now, this GP presumably didn't know he was positive until he tested. And of course, the day before he was tested, he could have been spreading it to all his patients. And if he was at work, presumably he was feeling okay. So my question would be, if there's mass gatherings coming up in Adelaide, do we know that no one in that crowd is carrying the virus in an asymptomatic way? Now, I don't know of any cases in Adelaide, but there are cases in Australia. So I would think in the next few weeks, we have to assume that the virus is present, that there is some community spread. So, for example, if we take the situation in Italy, I made a video a few days ago about the situation in Italy. And I said, look, the death rate seems high in Italy here because they've only had the virus for a week. But then people wrote in to correct me and said, no, the virus has probably been in Italy for 2 or 3 weeks before it was known to be there. So the Italians had a problem, but didn't know they had a problem for a week or 2. And that's a concern. So the question is that the situation in Australia? Is the virus there? But we don't know that it's there, because if it was there in asymptomatic or pre-symptomatic individuals and he was in close contact with people at a football match or a big crowd, then he would spread it. So my feeling is, at the moment, we should be avoiding large crowds because we don't know how many people in the population are carrying it asymptomatically. It's like that 50-year-old man that died in America. He had no obvious epidemiological links. Don't know how he got it. Presumably some form of community spread. So I feel that it would be inappropriate to have large meetings in Adelaide. We know Italy's banned football matches, so but they know they've got it. But for the next few weeks, you see, there's a delay here. When it starts community spread, like in the Italian situation, so God willing this hasn't happened, but suppose community spread started yesterday in Adelaide, then we might not know about that for a week or 2. And in which case it could have already gained a self-perpetuating foothold. Now, God willing, that's not the case, but I don't know that. I can't tell you it's not there. Just that we're not recognising it yet. So avoiding crowds at the moment, I would say yeah, I think we should be avoiding crowds everywhere for the time being and instigating these changes in social behaviour around the world. I think it probably is time to do that. The more we can isolate this, the better. John L. asks, is the virus engineered? No, I do not believe it is. I've had debates about this recently. I'm not a brilliant geneticist. I can only do basic genetics. and genetics is a remarkably complicated subject. But the accepted wisdom is that this is a zoonotic virus. The other coronaviruses, the MERS, the Middle East Respiratory Syndrome, the SARS 1, 2002, 2003 coronavirus, they are known now. The work has been done retrospectively. They are known to be zoonotic. The geneticists all accept they are zoonotic. They have come from, well, most geneticists, they accept they have come from animals. And I believe this to be the same. Now, because I don't understand the genetics here, you get people saying about this sequence and that sequence. Don't pretend to understand it. I'm just a simple A&E nurse and teacher. And most doctors I've worked with don't understand that either. That's for sure. Medical doctors don't understand it very well. Geneticists do, but so I would only accept that this virus is genetically engineered if that was in the peer-reviewed publications in proper journals like Nature or science journals or genetics journals. Because I don't understand the science well enough, I would take the geneticist's word for it, and if it was in a peer-reviewed publication that it was engineered, I would then believe it. Until then, I won't. I think it's a zoonotic virus, the same as the other coronaviruses that we've had problems with in the past. There's also 4 coronaviruses that cause common cold type features that are well known, and again, these have been fairly well studied and characterised, I believe, and they are recognised as zoonotic infections. They come from animals. So I suspect the Chinese will be much stricter in future about eating animals taken from the wild, and the whole management of animals taken from the wild. So no, I do not believe it's engineered. I believe it is zoonotic. Rahila, any thoughts on India? Rahila, I'm not quite sure. Is there any confirmed cases in India yet? I haven't heard any. Check on the Johns Hopkins website. Any thoughts on India? The answer is yes. I've visited and worked in India a little bit, a few times, and a lot of people live in very poor quality housing, very close together, often many members of the family and other workers all packed into a relatively small space. So if one of those became infected, the virus has got the possibility to spread quickly. The other thing in India, it's a bit like China. People often work away from home, so dad will go away and work in the city and then come back to his village, and all that travelling around is also a good way to start spreading the virus around. A lot of people in India don't have access to quality healthcare. So am I worried about India? Yeah, I am. Bangladesh, Pakistan, many African countries, areas where there's a lot of people living close together. Limited opportunities for quarantine, and limited access to expert healthcare advice. So I'm worried about all of these places, and it's not just me. The World Health Organization has been worried about these places where there's poor health infrastructure for a long time. In Iran, for example, I think there's probably many more cases than we are currently receiving news about at the moment. And the problem is that causes a cluster of new cases. You can end up getting self-perpetuating community spread in those clusters. And from there it can spread out into other places. So yes, I am worried about India, although I think that the problem is not very grave there yet, but really time to start taking precautions now. Did the US drop the ball? You know, I think we might look back and say quite a few of us have dropped the ball on this. The reason I started doing these broadcasts was I became worried about it when I realised the way this virus was transmitted, and realised this potential So yeah, I think a lot of people have dropped the ball. We really need to try and contain this as much as we can now through the sort of things we've talked about. Does gargling whiskey help? No, because the reason being is firstly, I'm not sure if the alcohol's strong enough. These alcohol gels are 70% plus, whereas whiskey's 40%. But of course, it won't get into the lower airways where the virus is reproducing. So gargling whiskey, I would not currently recommend at this stage, unless you particularly like it, of course. No, it wouldn't be a recommendation. Yeah, okay. Couple of questions here. Does flatulence spread the disease? I don't know. Feces can. So I don't actually know the answer to that question. But contaminated feces can cause fecal transmission, possibly through the air, possibly through this spraying out effect when toilets are flushed, because some people do excrete the virus from the gastrointestinal tract, and urine possibly infected as well. That's possible. Now, can mosquitoes spread the virus? I think that is very unlikely, because the mosquitoes are going blood to blood, and most people are ill. From the early data we have from China, most people that had the infection didn't have the virus in their blood. They didn't have what we call a viremia. So for it to be spread by insects, it would have to go from the blood of one person into the blood of another person. And as far as I know, that's not happening at the moment. So it's not a concern at the moment, no. Pneumonia. Will pneumonia vaccine help? So pneumonia vaccines only work against particular bacteria. They won't work against the virus. So the answer is no. Will they reduce the possibility of some types of secondary bacterial infection? Possibly, yes. But the vaccines against pneumonia we have now will not protect against the virus. It is a different antigen. We need a specific vaccine for this specific virus. I've been going for an hour and a half now. I think it's nearly time to finish. Is the UK ready for this? Well, the problem with the UK is that at the moment our hospitals are already quite full with people with flu. So it's going to be difficult to look after a lot of extra sick people all at the same time in the UK. Are we ready for some cases that we can isolate at early stages, as we have done? Certainly. Are we ready for thousands of people getting sick all at the same time? No. No, we're not ready for that. Situation in Africa. Haven't checked Johns Hopkins on that this morning, but yesterday there was one case in Nigeria, one case in Egypt. But as we've said, any area with poor healthcare infrastructure is going to be more at risk. So sub-Saharan Africa is clearly a concern. And another reason for being pessimistic about that is there's been an awful lot of coming and going between African countries and China. There's a lot of very impressive infrastructure projects in Africa that are organised by Chinese engineers. So there's quite a lot of links, so I would be somewhat pessimistic. African countries should be preparing absolutely as much as they can now. If they have this opportunity. Can acyclovir antiviral medication help? Now, I strongly suspect that acyclovir might be one of the ones that the Chinese are testing at the moment. Now, acyclovir is quite an effective antiviral, but it only works against herpes simplex virus, as far as I know. So I've used it. It's good for cold sores. You get this cream for cold sores. That's herpes virus. It's good for those. And some systemic herpes simplex viral infections we use acyclovir for. Now, if acyclovir works against the coronavirus, I would be surprised, because the coronavirus is different from the herpes virus, the herpes simplex virus. So the answer is, does acyclovir work against the virus? I don't know. I suspect probably not, but it may well be one of the drugs the Chinese are testing, so we could know the answer to that question in a couple of weeks. But it's a very good question. The remdesivir, the antiviral drug that was developed for Ebola, is showing promise. Now, that's not meaning to say the coronavirus is the same as Ebola. It's not, but there seems to be some promise that it might be effective against the coronavirus. So we should know these things in a couple of weeks. It would be great if acyclovir was effective. I would be surprised if it was, but let's wait for the data. Very good question. Right, Hugo's asked, can sperm spread it? Now, it can be spread by mucous membranes. So mouth to mouth could obviously spread it, and presumably sexual spread is also possible, but we don't know. There was a study done in China, but vaginal secretions were not actually tested to see if the virus was excreted. So don't know that one, but mucous membrane to mucous membrane, I'll leave you to use your initiative on that. Is possible. So certainly mouth to mouth kissing could transmit it. Yes, it's mucous membrane, especially to mucous membrane. So many questions about masks. I wish I could give you a definitive answer about masks. I think masks, if you wear them a lot, for example, I've heard about, because in China it's obligatory to go out with a mask, it's illegal not to. In most areas, I think, then people have been using second-hand masks, which is just a disastrous idea. Although masks are being made available through Chinese outlets at very low prices, controlled by the Chinese government. But if a mask is wet, it's worse than nothing at all, probably. And if a mask is contaminated, it's certainly worse than nothing at all. So masks are going to be of some benefit in some close quarters situations. But the idea that a mask is going to stop you getting this is not true, because you can get in through the eyes as well. It might stop you spreading the virus as much to other people. But if it gets wet, it's going to be pretty useless. And the big thing about masks is it reminds you to stop touching your face. And the other concern I have about masks is people might think I'm wearing a mask so it's okay. Masks are not a panacea against infection, and how effective they are really is open to question at the moment. So masks, yes, many governments are suggesting we use them. Are they going to fully protect us? No. Partly, if at all, is the answer. Ultraviolet light or hydrogen peroxide. Right, so for disinfectants, for cleaning